Hello and welcome back. My name is Joseph Tsuma, always your favorite doctor. And of course, when you see me here, you know it matters health, and I'm here to bring you trusted health information wherever you are. You can follow us for simple, updated, practical, and reliable medical insights that will be able to keep you and your family healthy. You can subscribe to my YouTube channel at Doctor on Wheels. You can also follow me on TikTok at Dr. Itsuma, as well as on our social media platforms as well. Now, today I want us to discuss about ectopic pregnancy. And before we dive into today's topic, let's listen to some words of wisdom. So, our words of wisdom today comes from the book of Matthew, chapter 7, from verse 7 to 8. And the Bible says, "Ask and it shall be given unto you, seek and you shall find, knock and the door will be opened unto you. For everyone who asks receives, and everyone who knocks, who seeks will find, and everyone who will knock the door will be opened unto him." So today, take courage. If there's something that you've been asking God for, you've been trusting God for, keep doing it because the Lord listens to those prayers and He will answer them. So let us dive into today's topic. So we're going to discuss about ectopic pregnancy. So what is ectopic pregnancy? So ectopic pregnancy basically means a pregnancy that is outside the uterus. So the uterus is by far designed to carry the pregnancy. So every time the pregnancy grows outside the uterus, that one is ectopic. So ectopic basically means abnormal pregnancy or pregnancy that is outside the normal area where it's supposed to be. Okay. Now, if it doesn't happen in the uterus, it can happen anywhere else, and most of the time it will happen in the fallopian tube. And basically, the fallopian tube pregnancy or account to around 95%. And then the other sites that the baby can grow, okay, including the ovaries, okay, or even the cervix or even the abdomen, which account for around 5%. Now, ectopic pregnancy affects around 1 to 2% of all pregnancies. So, which means if you have around 100 women who are pregnant, around 1 to 2 of them will be affected by ectopic pregnancy. And by far, it is one of the major causes of sickness and even death for mothers who end up getting pregnant. Now, who are these people who are at risk of developing ectopic pregnancy? So number one, if you have had anything that causes damage to the fallopian tube, okay? So, like for example, if you have been treated or you have had pelvic inflammatory disease, which is one of the sexually transmitted infections, okay? Or if you have had surgery, so previous surgeries to the tube. So either you had a previous ectopic pregnancy and you ended up doing a surgery because of that, okay? Or you probably had infertility because of tubal blockage, and then there is a surgery that was done on the tube to try and open it up, okay? So that one basically increases the chances of you developing ectopic pregnancy. And then the other thing is if you end up getting pregnant when you have the IUCD or the intrauterine contraceptive device, the coil, okay? So basically it will block the uterus and therefore the baby or the ovum will implant outside the uterus. And then other things that can cause ectopic pregnancy include smoking. So a mother who gets pregnant while they are smoking, okay, or conditions such as endometriosis, okay, or even advanced in age, okay, or patients who end up getting pregnant when they are using contraceptives such as progesterone only pills, okay. So, how do you make a diagnosis? So, there is what we call the clinical triad, or 3 things that you will never miss in a person who presents with ectopic pregnancy. But even if you miss the 3, 2 of them must be present for you to be able to make a diagnosis that this patient might be having ectopic pregnancy. So number one is history of amenorrhea. So this person will have missed their periods. Okay. So number two is abdominal pain. And that abdominal pain will specifically be localized either on the left lower abdomen or on the right lower abdomen. Okay, but that one might be the site where the pain starts, and then it can now end up being a generalized abdominal pain. And then the third thing is vaginal bleeding. Now, if probably this ectopic pregnancy has not ruptured, okay, you will end up with either the history of loss of your normal monthly periods, you missed your menses, and abdominal pain, but bleeding might not be present. Now, the other thing that these patients might present with, they might also present with shoulder pain. Okay, so the tip of the shoulder might be painful, and that is because of irritation of the diaphragm, especially when you have had ruptured ectopic pregnancy and the bleeding is in the abdomen or the peritoneum. Now, with excessive bleeding, these patients will also present with dizziness and fainting attacks, okay, with basically signs of shock, okay. Now, when you do the examination, of course, there will be a lot of pain, a lot of tenderness in the abdomen, okay, and then when you do examination as well, there will be cervical motion tenderness, and then there will be all the signs of shock, okay. So, cold extremities, okay, the heart rate will be elevated, and then the blood pressure will be lowered, and all that. So all the clinical signs of shock might be present in this person, especially if there is a rupture. Now, when you come to the hospital, what are the first things that we do? So we need to confirm first of all that this person is pregnant. So we'll do a test to confirm that this person is pregnant. So if they are pregnant, if they are not pregnant, then ectopic pregnancy is ruled out. But then if the test turns positive, shows that you're pregnant, okay, then we go ahead and do an ultrasound. And the ultrasound should be able to demonstrate three things. So number one, it should be able to demonstrate that the pregnancy is outside the uterus. Number two, it should be able to demonstrate and basically show us exactly where this pregnancy is. So it can show either some adnexal mass, so it can actually show where the pregnancy is, either on the left or on the right fallopian tube, and also we should be able to tell us whether it is ruptured. So presence of free fluid in the pouch of Douglas, that is the posterior side of the cervix inside, okay, will be able to, so when you get some fluid there, then basically it will demonstrate that there might be a rupture. Okay, so what do we normally do? We do at least a full blood count to be able to ascertain exactly what's happening, but also these patients will need to be transfused. So blood grouping and cross match to be able to be transfused. But of course, before that, they will be given some IV fluids. Okay, and then they will be prepared. They need to be prepared for an emergency procedure to be able to stop that bleeding and basically remove that ruptured ectopic pregnancy. Now, there are some other diseases or there are some other conditions that can mimic ectopic pregnancy. So number one is when you're having incomplete or threatened miscarriage. Number two is ovarian cyst or ruptured ovarian cyst or torsion. And then number three is appendicitis, especially on the left side, or even pelvic inflammatory disease, or even any other condition that can basically mimic acute abdomen. Like for example, when you're having a strangulated inguinal hernia, okay, or intestinal obstruction, okay, it can present with that kind of abdominal pain. Now, how do we manage? Of course, once the patient comes to the hospital, stabilization is very important. So IV fluids, blood transfusion, given oxygen, and then they will need to be prepared for surgical procedure to be able to manage the condition. So some of the surgical procedures that will be done, especially for non-ruptured ectopic pregnancy, is salpingostomy, which is basically a tubal preservation surgery. So you just cut and then remove the pregnancy and then you repair the tube. Or you can do salpingectomy, which basically is going ahead to basically cut the whole area where the the pregnancy had ruptured, and then you tie the two ends. Now, that one can be done either laparoscopically or laparotomically. Okay, but also we have some other medications that can be used to treat the same condition. A drug called methotrexate, which is one of the drugs that has been used to treat or to manage ectopic pregnancy. So methotrexate is anti-folic acid. So it antagonizes folic acid. Now folic acid plays a very important role in cell division. So it means that if you stop the effect of folic acid, it means the cells will stop dividing, and therefore that embryo basically will die. Now, the disclaimer here is that you need to be very careful. Do not use methotrexate to procure abortions, because methotrexate is that one of the drugs that is used in cancer treatment as well. So, what are some of the complications? We have the immediate complications and we have the late complications. So, the immediate complication, of course, after rupture, there will be a lot of bleeding, and that bleeding can lead to shock, and that shock, if not well managed, can lead to death. And then the late complication is what we call subfertility, because now, if you end up cutting that tube to remove that ectopic pregnancy, it means that side is already non-functional, so you'll end up with one fallopian tube. Now, we say that previous ectopic pregnancy increases your chance of developing another ectopic pregnancy. So, which means by actually 10%. So, which means if you had previous ectopic pregnancy and then you are among the 10% and you develop another ectopic pregnancy, it means then you will end up to be completely fertile. And then, of course, the psychological impact that comes with it. Okay. Now, how do you prevent ectopic pregnancy? Number one is you need to treat those sexually transmitted infection, that PID, that abnormal discharge that you are having, that you fear to go to the hospital, okay, because of either stigma, you don't want to, you fear sharing it out with someone. It needs to be managed because it might be the reason why you might end up with ectopic pregnancy. So, and then number two, we have those high-risk mothers. So if a mother had previous ectopic pregnancy, she becomes a high-risk mother who needs to be monitored so closely, especially the next time they get pregnant. Okay, and then of course we need to do an early scan in the future pregnancy, because that is the first trimester ultrasound is very important. So an early scan will be able to identify if you have an ectopic pregnancy, and it will be able to be managed. And of course, use of contraceptives, okay, to prevent getting pregnant the first place, okay, and by far that will be able to help in management but also in prevention of ectopic pregnancy. Now, by far, that is what, in a nutshell, you need to know about ectopic pregnancy. Now, if you are new here, please consider subscribing to our YouTube channel at Dr. McQuills. You can also follow us on our social media platforms. You can also follow me on TikTok at Dr. Ritsu. Now, if you experience any of these symptoms, you can always call us. Our number, you can always call us. But also you can also follow us, you can also visit us at our hospital. We are located at Lupsil Center in Ngong, and we will be able to assist you. Until next time, God bless.